Hello, everyone. My name is Aramandla Ramesh. Today, I am going to present about vulnerable populations and immunization disparities and what is the impact of COVID-19 on immunization disparities in these special populations. I am a researcher associated with the National Center for Medical Education Development and Research, which was established in 2016 at Meharry Medical College. Our leadership team includes Dr. Irene Sanwald, who is the project officer at HRSA, and Dr. Patricia Matthews-Juarez, who is the project director, and Dr. Paul Juarez, who is the center director, and Dr. Catherine Y. Brown, Director Communities of Practice and Dissemination, and myself serving as Director of Research. And our center was established to address the needs of vulnerable populations, especially people who are LGBTQ, persons experiencing homelessness, and migrant farm workers. Over the span of 5 years, we have established 3 communities of practice. And along with the communities of practice, we developed curriculum modules. We conducted systematic surveys, and we also developed policy briefs and generated manuscripts on 10 research topics that specifically focus on vulnerable populations. Of healthcare providers to address the primary care needs of these vulnerable populations serve as a barrier to persons who are seeking and receiving treatment for COVID-related health issues, especially in the sexual and gender minorities. Others are not far behind. People experiencing homelessness, they also suffer from facing COVID issues because they live in congregated settings with poor hygiene practices and limited social distancing. And migrant farm workers also are severely affected because they also live in similar cramped working conditions. Especially, they do not have transportation, they face language issues, they do not have a regular healthcare provider, and they do not have any source of care. So what we did was we conducted a systematic review on how medical school curriculum trains students in addressing immunization disparities that not only pertain to COVID, but also to other diseases as well. We screened several databases using PRISMA guidelines to identify relevant literature. What we found was, out of the more than 3,500 articles screened, only 54 studies were identified that focused on the impact of COVID-19 on immunization disparities experienced by vulnerable populations. And what we realized was there was a serious health disparities gap for vulnerable populations. And that could be addressed from many angles. So we have come up with some recommendations, and we found out strategies that would benefit these groups are the linkage to care, improving provider education, cultural competencies, reduction of institutional bias, chronic disease management, and patient-centered medical home care, among several others. We made our presence on social media. You are more than welcome to contact us should you need any additional information or if you are interested in partnering with us in our research journey. Thank you very much for your attention.